is Addie Friesen, and I will be doing my microbiology research presentation on exercise-induced pulmonary hemorrhage, otherwise known as EIPH, more focusing on the blood-gas barrier in equine. What is EIPH? EIPH is a condition that happens during extreme exercise and is very common for high-performing athletes such as racehorses and endurance dogs. Focusing more on racehorses, they have always been bred for speed, and they now carry a heart that weighs up to 2% of their body weight, which is not normal when comparing other mammals at a half to 1%. EIPH was first observed in the 1600s when racehorses showed blood flowing from their nose. As you can see in the picture on the right, that is what they witnessed back in the 1600s. With today's technology, we now know that blood coming from the nose is not the only horses that have this condition. According to Platinum Performance rider Bengoa, there is 89% of racehorses that also have this condition, but do not show any visible signs, more or less a just poor performance that day. The fastest way to diagnose EIPH is to scope the lungs for visible signs of blood in the lungs. When a veterinarian scopes the lungs, if the horse has EIPH, they will find red blood cell capillaries that have been ruptured and are now in the lungs. And this is from oxygen that flows in through the nostrils and into the lungs at a high rate during exercise, creating a negative pressure in the alveoli, which in turn is forcing blood cells through the blood-gas barrier, which, keep in mind, is only 1/50,000th of an inch. And that is the location where oxygen and carbon dioxide would normally exchange. This results in blood pooling in the lungs, which can reduce the performance of an equine athlete. On the blood capillary side of the blood-gas barrier, you can see in the illustration that the pressure in the capillary is positive and the alveoli pressure or lung pressure is negative when a horse is experiencing hard exercise. The blood that is flowing in the capillary is coming from the heart and is needing carbon dioxide exchanged for oxygen. Blood coming from the heart is flowing at 400 liters per minute. With the heart beating 4 times per second, this creates problems after the blood has been pumped through the body or distributed to the muscles, and it's making its way back around to the lungs to exchange CO2 for oxygen. The negative pressure on the blood-gas barrier creates resistance for gas to be exchanged, and the positive pressure on the inside of the blood capillary in turn backs up red blood cells and has to let pressure out by releasing red blood cells that are escaping into the lungs through the blood-gas barrier. On the lung side of the blood-gas barrier is the alveoli tissue in the lungs. When the blood-gas barrier is broken by red blood cells, they are released into the lungs. Depending on the severity of the red blood cells that have escaped into the lungs, they can affect the lung tissue by scarring. The scarred lung tissue creates a problem because it can become rigid and hard. The rigid area in the lung tissue can make it very hard to breathe for the horse. The scarred tissue also will not be able to exchange gas as rapidly as healthy tissue, and in return, causing more bleeding in the lungs. In the illustration, you can see that the image on the left this would be the red blood cell capillaries in here, and then this is the alveoli tissue that would be in the lungs. Here is where the exchange would happen into the alveoli tissue of the red blood cells, breaking the blood-gas barrier. And on the right, this is a microscopic image of the alveoli tissue, and is representing the red blood cells, and P would be representing the pores that are in the blood that are made in the blood gas barrier that the red blood cells created when they escaped through the barrier. The blood gas barrier repairs itself very quickly when this occurs. When there is in excess red blood cells flowing through the blood gas barrier, it is very hard for the blood gas barrier to repair itself, and in turn, this can create a lot of scarred tissue in the lungs. The treatment for EIPH in horses has surfaced in the last 80 years, even though this condition has been around for hundreds of years. Experiments conducted by Dr. Poole of Kansas State University tested furosemide and flare strips, a bronchoalveolar lavage, also known as BAL, which flushes the fluid of the alveoli tissue in the lungs. The fluids will appear to have blood in them if the horse does have a positive case of EIPH. The red blood cells in the fluid flushed from the lungs are then counted. BAL is the most accurate way to know exactly how much blood has entered the lungs after a case of EIPH. The nasal strips on the left were tested and proved to reduce bleeding by 50%. Nasal strips work by opening the nasal cavities, and this in turn will reduce the pressure in the airways. So when air is sucked into the lungs by breaths, it reduces the pressure that is exerted on the blood gas barrier in the lungs. Furosemide is a drug that is more for dietary issues. The exact reason why furosemide works to relieve pressure on the blood gas barrier is uncertain, but it works according to Dr. Poole's experiment. The furosemide reduces bleeding by up to almost 85%. Furosemide works in the horse by making the animal relieve water that was held in the gut. Some believe furosemide works so well because of the fact that it relieves 20 to 40 pounds of urine, of water that is held in the gut by just a single dose. And this will make the stomach lighter when the organs bang around during endurance races. Others believe that the drug has some effect on the trachea and how fast the air actually reaches the lungs. But no experiments have been successful in finding the reason for the success of this drug. This is my works cited page, and thank you for listening and watching.